السلام عليكم. This is the third lecture about the biliary tree and biliary and gallbladder disease. Cholangitis. It is stone in the common bile duct and biliary tree. Stone in the common bile duct and biliary tree. We call it cholangitis or biliary stone. We can classify biliary stone into primary and secondary. And primary mean from the start the stone formed within the common bile duct, while the secondary mean that the stone come from the gallbladder and pass through the cystic duct to the common bile duct. The primary biliary stone are rare. Primary biliary stones are rare, and usually these are brown pigmented stones. The primary biliary stones are formed in the common bile duct and biliary tree itself, and are multiple, often sludge-like, commonly pigmented or mixed type of stone. Sometimes extend to the hepatic duct, particularly the brown pigmented stone. يعني الستونز اللي تتكون داخل الكومن بايل دكت or biliary tree عادة تكون من نوع pigmented stone اللي يصير بي extension upward even to the hepatic duct, right or left hepatic duct, حتى تنطي بعض الأحيان شكل الهيباتيك duct والكومن بايل duct, and usually multiple. بعض الأحيان يصير لايك sludge or مثل الطين، يصير البايل كله thick and obstruct the common bile duct. The causes of the primary stone in the biliary tree are either defect in the pathophysiology of biliary tree itself. يعني أكو problem within the physiology of the common bile duct, like the stasis or biliary dyskinesia. يعني ماكو relaxation of the sphincter of Oddi, and there will be dilatation of the common bile duct, stasis of the bile, then formation of primary stone. Or it be congenital dilatation of the biliary tree, like the choledochal cyst اللي حكينا عنها بالمحاضرة الثانية, or Caroli's disease. Caroli's disease means intrahepatic biliary dilatation, when it is precursor for the cholangiocarcinoma of the biliary tree, مثل choledochal cyst. يعني عندنا الcholedochal cyst and Caroli's disease these are predisposing factor for cholangiocarcinoma. طبعا الcholedochal cyst we can, if it is a fusiform or secular type, it can be excised, but if it is within the liver, the only hope for the treatment is the liver transplant, مثل الCaroli's disease. Infection or infestation with parasitic infestation like the Ascariasis or coronary calcinosis. Scars normal inhabitant of the biliary tree, يعني scars worm عادة تصعد from the duodenum through the ampulla of water and go to live in the biliary tree, and for that it will cause obstruction for the biliary tree and obstruction for the common bile duct, stasis of the bile, and formation of the stone. The other cause of the primary biliary stones are low protein diet, يعني cachexic patient, malnourished patient, or even the obesity itself. It will cause secondary stone more than the primary, but it sometimes can cause primary gallstones, primary biliary stones. In old age, even more liable for developing of primary biliary stones. مثل ما تشوفون هنا بالصورة هاي, this is the gallbladder cholecystectomy done, and these are the stone in the left hepatic duct, stone in the right hepatic duct, stones, pigmented stone in the common bile duct. These are the primary stones within the biliary tree. Secondary biliary stones are formed within the gallbladder. يعني هي gallstones وتعبر إذا كانت small stones والwide cystic duct تعبر من الجولبلادر إلى البيلياري إلى الcommon bile duct and causing biliary obstruction. In these cases, in the secondary biliary stone, the common bile duct and biliary physiologically normal. يعني ماكو فد problem, ماكو dyskinesia, ماكو stenosis, ماكو أي problem with the common bile duct. The problem in the gallbladder itself. ستونات بالجولبلادر وتعبر من خلال السيستيك duct إلى الcommon bile duct. Secondary stone are easier to manage than primary stone. خلي بالك إنه secondary أسهل لأنه we have no problem within the biliary tree. ما عندنا لا congenital anomaly ولا عندنا biliary dyskinesia. The treatment of the secondary easy because we treat the causative factor اللي هو الستونات الموجودة بالجولبلادر وراح نشيل الجولبلادر itself ما راح تتكون بعد ستون ولا تعبر الستونات إلى الcommon bile duct. فإذا we treat the primary cause for the stone formation is the gallbladder. Removal of the gallbladder will treat any other secondary stone within the biliary tree. Commonly, the gallstone get impacted in the supraduodenal portion of the common bile duct, causing obstructive jaundice. يعني fate of the secondary stone اللي تيجي من الgallbladder إلى الbiliary tree, it will be impacted in the supraduodenal portion of the common bile duct, causing the obstructive jaundice. It's seen in 15% of patients with gallstone. يعني 15% من كيسات الحالات المرضى اللي عندهم gallstone 15% من عندهم ممكن الستونات من الجولبلادر تروح على البيلياري تري causing obstructive jaundice. 75% are cholesterol stone. Type of the stone اللي تعبر عادة هو cholesterol stone اللي يكون smooth surface أو نسميه gallstone solitaire single and smooth surface اللي ممكن تعبر بسهولة from the cystic duct إذا كان cystic duct wide إلى common bile duct. 5% are pigmented stone. 5% of the secondary stone are pigmented stone. Then, secondary stone, character of the secondary stone, easier to manage than the primary stone. Commonly, common bile duct stone impacting in the supraduodenal portion of the common bile duct and causing obstructive jaundice, and it's seen in the 15% of the patient with gallstone, and 75% are cholesterol stone, 5% are pigmented stone, and the other percentage is for the mixed gallstone. The clinical feature of the biliary stone within the common bile duct. Either incidentally, we found stone in the common hepatic or common bile duct without causing jaundice or sometimes causing jaundice. يعني احنا نسوي سونر للمريض نشوف اكو gallstone وعنده stone in the common bile duct but without jaundice. يعني البايل يقدر يعبر من داير مدار الستون and the stone not impacted in the supraduodenal portion of the common bile duct. That's why the patient not present with obstructive jaundice. Secondly, it may cause pain. The pain is severe pain, colic in nature, intermittent, and associated with fever or rigor and with jaundice. And we call this if we have pain, fever or rigor and jaundice, we call this Charcot triad, mean the patient develop cholangitis. So the presentation of patient with biliary stone, either incidentally we found these stone without causing obstruction or jaundice, or it causes pain, fever, rigor, and jaundice. This means Charcot triad. انتبهوا على Charcot triad اللي هو ascending cholangitis. It presents with intermittent pain, colicky, intermittent fever, jaundice. طبعا fever with rigor. Complication of the stones in the biliary tree. Either it will cause, if you have long-standing biliary obstruction due to stone or any other cause, this will end with biliary cirrhosis. It will end with biliary cirrhosis, liver dysfunction and biliary cirrhosis. طبعا راح يصير وياه jaundice, يصير portal hypertension, راح يصير esophageal varices, يصير ascites. All the features of the liver cirrhosis will appear with splenomegaly أيضا, white bile formation and liver failure. With time, if you have stone impacting the common bile duct or in the biliary tree, راح يصير absorption of the bile from the common bile duct and from the biliary tree, and later on the bile would be without bile pigment, and this we call it white bile, and the patient end with liver failure. Sepurative cholangitis, inflammation of the biliary radicals due to stones within the common bile duct or the biliary tree. طبعا presentation مثل ما قلنا هو fever, rigor, jaundice and abdominal pain. And this, if we not treat the suppurative cholangitis, it will end with liver abscess, either single or multiple liver abscesses. طبعا the patient may end with septicemia, high fever, rigor, nausea, vomiting, and end with septicemia. And if not treated, it end with death. مثل ما قلنا, septicemia is one of the complications of stones in the biliary tree or in the common bile duct due to suppurative cholangitis and liver abscess and septicemia. Pancreatitis, if common bile duct stone is near the sphincter of OD, it will block the drainage of the bile and the pancreatic duct. If we have a stone pass through the common bile duct, reaching to the sphincter of OD, and if you have common pathway for the both, for the pancreatic and common bile duct, this will cause obstruction to the common bile duct and the pancreatic duct, will increase the pressure within the pancreatic duct and lead to triggering of the enzymatic reaction, which lead to pancreatitis. What investigation we send for patients with common bile duct or biliary stone? طبعا ultrasound on the top of the list. Normally the common bile duct diameter is less than 1 cm. طبعا بالelderly ممكن نشوف سنتيم واحد الكومن bile duct diameter. من younger age group 0.8 centimeter only, 8 millimeter. But if you have obstruction, the diameter of the common bile duct will be more than 1 cm. طبعا ERCP is the most important tool for diagnosis of the biliary stones, particularly if the stone within the lower third of the common bile duct. طبعا تعرفون ERCP هو عبارة عن gastroscope with side viewer pass from the mouth to the esophagus to the stomach and to the second part of the duodenum, and we cannulate ampoule of water and we introduce catheter, then dye, then we can use a basket to remove the stone from the common bile duct. MRCP, this is magnetic resonance imaging, and MRCP means magnetic resonance cholangiopancreatography. We use the same secretion within the bile, within the common bile duct and bile. That means the bile itself will be as a contrast for the visualization of the common bile duct and the biliary tree. And we can see any stone or any obstruction or any cause for stenosis or any cause for biliary problem can be seen by the MRCP. Even the important tool for visualization of the biliary tree, lower or upper third or intrahepatic biliary tree, is the MRCP. While the ERCP is very important for the visualization of the lower third of the common bile duct. Liver function test طبعا راح نشوف ندزها for total serum bilirubin, direct and indirect, SGOT, GPT, serum alkaline phosphatase, and prothrombin time, partial thromboplastin type, PT and PTT. Endo-ultrasonography, يعني EUS. This means by the gastroscope, at the tip of the gastroscope, we have ultrasound. We can visualize the lower end of the common bile duct, which cannot be seen by ultrasound due to gases and due to presence of the head of the pancreas. PTC, percutaneous transhepatic cholangiography, is only indicated for the upper third obstruction of the common bile duct or intrahepatic dilatation due to obstruction at the confluent of the common hepatic duct, obstruction at the beginning of the common hepatic duct. So we can use PTC and PTCD, percutaneous transhepatic cholangiography or percutaneous transhepatic cholangiography with the drainage. يعني عشان عليها بالمحاضرة الأولى we introduce Sheba needle and catheter through the intercostal space at the 8th intercostal space at the right side, and we under ultrasonic guide we can introduce this catheter inside the biliary tree, and we can cannulate the biliary tree and visualize the biliary tree, and then we can put a catheter to drain the bile until the patient jaundice will decrease and the patient will be more stabilized. Then we go to treat the primary cause for the jaundice. ERCP مثل ما قلنا هو endoscopic retrograde cholangiopancreatography. Through slide viewer gastroscope, sphincter of OD is cannulated and dye is injected. Biliary and pancreatic tree are visualized. It is done under local anesthesia under sedation with mild sedation with midazolam or propofol anesthesia. يعني نعطيهم anesthesia بسيطة more deep general anesthesia, and we introduce the gastroscope from the mouth. طبعا بعد ما ناخذ البرميشن مال المريض ونوقع على هيك تداخل منظاري، ونوقع الاهل ايضا عليه، لانه اكو ريسك اوف كومبليكيشن موجوده 1% ممكن يصير pancreatitis. Patient plays in the prone position with the head turned toward the right, and after passing gastroscope, sphincter is identified and cannulated under visualization of 3 millimeter of water-soluble iodine contrast is injected into the bile duct, and pancreatic duct will be visualized. يعني راح ندخل we would cannulate the ampulla of water وندخل small catheter دي ونحقن contrast وناخذ X-ray. راح نشوف biliary tree if there any stone, any stenosis, any tumor can be seen. Even we can sometimes we can remove the stone by using the basket. يعني ندخل في الكاثيتر، نفر الكاثيتر يصير مثل شبشة دار مدار الستون، بعدين مثل يعني سلة دار مدار الستون، بعدين نسحبه إلى الduodenum. Then we can remove all the gastroscope and remove the stone by this method. Or we sometimes we can put a stent، يعني عبار يسموه. If we have cholangiocarcinoma or biliary stenosis, we put a stent to bypass this obstruction, and the jaundice will be decreased with time, and we treat the primary cause later on. Indication of ERCP, either diagnostic or therapeutic. Diagnostic in the malignancy, irregular filling defect can be seen within the common bile duct or biliary tree, indicating that the pathology is carcinoma or any malignancy. Chronic pancreatitis تبين مثل chains of lakes، مثل بحيرات من البايل can be seen by the ERCP after injection of the iodine contrast media. Congenital anomaly can be seen مثل saccular dilatation of the biliary tree or the Carolus disease. Either the choledochrosis or Carolus disease can be seen by the ERCP. Stones within the common bile duct, يعني primary stones of the common bile duct, even secondary stone can be seen within the common bile duct. Structure of the biliary tree or stenosis of the biliary tree, choledochal cyst. Also through the ERCP you can sample of the bile, you can take sample from the bile and pancreatic juice and send for analysis and cytology. Brushing biopsy from the tumor site، يعني إذا عندنا cholangiocarcinoma lower end of the common bile duct, we can brush this tumor and send for cytology later on. Therapeutic, we can extract stone from the bile duct قلنا باستخدام الباسكت، or we can do nasobiliary drainage، يعني نفس الجاستروسكوب نفوت من النوز ويا نفوت a small catheter. When this catheter introduced inside the common bile duct, and we lift this catheter within the bile duct to drain the bile duct from high pressure bile within it. Then later on we remove this catheter. Or we can put a stent، plastic or metallic stent. نوع لكم من الستنتات plastic or metallic. طبعا راح ندخله داخل الكمان بايل دكت تشكل هناك، يبقى فترة ممكن 3 to 6 months. Those patients with obstructive jaundice due to tumor and advanced tumor, we cannot treat them. We can put this stent to as a palliative treatment for them. Or sometimes you put the stent to decrease the jaundice. Later on we go to do the surgery for them. يعني نخلي الستنت إلى الوضع يستقر إذا نريد نسوي له عملية، أو إلى أن الله ياخذ أمانته مثل ما يقولون، يعني palliative treatment. Also we can use it for dilatation of the biliary structure. إذا عندنا biliary structure due to trauma مثلا نسوي له عملية وصار structure، or inflammatory process صار structure, we can do dilatation by using the RCP. Endoscopic papillotomy in papillary stenosis and for the treatment of the external biliary fistula. يعني شنو معنى؟ إذا عندنا ampulla of water be stenosis or spasm صار we can introduce dilator through the RCP, and we can do dilatation for the ampulla of water. Or if we have biliary external biliary fistula، يعني مريض مسوي له مثلا نقول عملية مال biliary tree، أي عملية خاصة مثلا إذا liver hydatid cyst، وهذا الhydatid cyst communicating with the biliary tree، وخلينا درين بالسايت of the hydatid cyst، يظل هذا الدرين يطلع بايد شهرين ثلاثة، عادة من 4 إلى 6 weeks. طبعا إذا ظل after 6 weeks still bile drainage from the site of the operation، أنا بخلين تيوب درين بيطلع بايل. إذا إيش راح نسوي؟ نروح بالإي آر سي بي نسوي سفكتروتومي we decrease the pressure at the lower end of the common bile duct, that's why the bile will not go outside the body عن طريق الدرين, راح يجي وين ينزل عن طريق الكمن bile duct إلى الduodenum, because we dilate the, or we do a sphincterectomy for the ampulla of Vater. Complication of the stone and the common bile duct. Pancreatitis is one important complication for biliary stones, because it causes obstruction for the pancreatic duct, increased pressure within the pancreatic duct. This will trigger the enzymatic reaction, lead to pancreatitis. طبعا the treatment is treatment of the gallstone at the first week after pancreatitis. إذا المريض عنده acute pancreatitis والcondition not that severe, يعني mild to moderate, we can go to do cholecystectomy for the patient in the first week after pancreatitis. Duodenal injury or perforation ممكن one of the important complications of ERCP is duodenal injury and perforation. البنكرياتايتس هنا حكينا عنها ممكن يكون complication of stone in the common bile duct, or it is complication of the ERCP. ERCP can cause pancreatitis because we introduce the dye to visualize the biliary tree through the RCP. This will trigger the pancreatitis, or the catheter itself will obstruct the lumen of the pancreatic duct, lead to pancreatitis. Even pancreatitis as an iatrogenic cause for pancreatitis may be the RCP, or the other cause of the pancreatitis اللي حكينا عنها هو stone in the common bile duct. Even the complication of the RCP may be pancreatitis due to contrast media and ERCP. The other complication of the ERCP may be duodenal injury or perforation. يعني احنا راح نستخدم الاير to inflate the duodenum and the stomach. This one may cause perforation for the duodenum or even for the stomach. Cholangitis, because we use contrast media, this contrast media may trigger inflammatory process within the biliary tree, lead to cholangitis and fever or rigor and jaundice with pain. Bleeding from the pancreatic duodenal artery. We may injure the pancreatic duodenal artery during RCP, and this lead to severe bleeding. Sphincter stenosis, because if we did frequent cannulation for the ampulla of water, and this lead to inflammatory process within this sphincter and lead to stenosis. And the other complication of the ERCP is complication of the gastroscope itself. يعني احنا بندخل gastroscope راح ندخله from the mouth. We may enter the oropharyngeal space side, oropharyngeal side, or the lower end of the esophagus can be injured, or the patient may develop reflex esophagitis, or the patient may develop aspiration of the gastric content. يعني احنا نفوت السكوب and تبقى esophageal junction patent. ممكن this lead to aspiration of the gastric content within the to the trachea and lead to pneumonia. These are the important complications of the ERCP. Pancreatitis, iatrogenic pancreatitis due to ERCP, duodenal injury and perforation, cholangitis, bleeding, sphincter stenosis, and complication of the gastroscope by itself. مثل ما تلاحظون هنا هاي الاناتومي نورمال اناتومي. هذا الجول بلادر. This is the gall bladder. هذا gall bladder. cystic duct هذا كمان hepatic right and left hepatic duct. هاي الخضراء هي كمان بايتك. هاي pancreatic duct. شوف هنا كمان pathway here. هنا السايت إذا دخلنا ERCP from this opening here, it may obstruct the common hepatic, obstruct the pancreatic duct, lead to pancreatitis. Or the contrast by itself go inside the pancreatic duct, triggering the pancreatitis. هاي الصورة هي الإكس راي الماخذين للمريض. هنا هو هذا الجاستروسكوب، سايد فيور جاستروسكوب. هذا السايد فيور جاستروسكوب. هذا وهنا السهم this arrow this هذا واضح هنا. وين هذا filling defect بالcommon bile duct, بالlower edge of the common bile. This filling defect is the stone within the common bile duct. الصورة هنا أيضا واضحة هنا. هذا الجاستروسكوب مع ERCP. هاي common bile duct by extra intrahepatic biliary tree. common bile duct dilated. وعندنا lower end of the common bile duct مثل تلاحظوا هنا acustinosis. إذن acustinosis stricture at the lower end of the common bile duct could be due to cholangiocarcinoma or could be due to benign condition. Usually such stenosis may be due to cholangiocarcinoma. يعني shortening of the common bile duct كل شيء clear here. هذا another ERCP. هنا واضح هذا هو ERCP. هذا البلير هنا الكمن بايل duct. هذا الكمن بايل duct هاي intrahepatic biliary dilatation. اكو هنا filling defect. تلاحظون هنا السهم وين ماشي على translucent area. هذا هو stone in the lower end of the common bile duct diagnosed by ERCP. stone in the lower end of the common bile duct diagnosed by ERCP. هنا ايضا هنا this is هذا تلاحظون هذا الكاثيتر. هذا هو الكاثيتر introduced by a Shiba needle or Okanda needle from the 8th intercostal space posteriorly at the posterior axillary line on the right side. This is called the PTC, percutaneous transhepatic cholangiography. تلاحظون اكو ستون بالcommon bile duct. هذا الفيلينج defect diagnosed by PTC. إذا PTC أيضا we can diagnose stone بالcommon bile duct, but particularly for the upper third of the biliary tree. يعني right and left hepatic duct can be diagnosed well by PTC أكثر من ERCP. طبعا هنا الداي عابر من الكمن بايل duct عابر على الديودنم. هذا تلاحظون الداي داخل الديودنم. هنا الداي داخل الديودنم. تلاحظوها كلش واضحة. هاي filling defect عبارة عن stone in the lower end of the common bile duct. This is a PTC. Treatment of the stone in the common bile duct, choledocholidiasis. Either ERCP طبعا من lower end of the common bile duct stone or open or laparoscopic choledochotomy. This is what it means. Choledochotomy means that we will open the common bile duct and we remove the stone and we suture it primarily or put a T-tube inside it. How we prepare a patient with common bile duct stone for surgery? طبعا we admit the patient to the hospital. We give him fluid and good hydration. ما نخلي patient dehydrated, and support for the liver and for the body by dextrose solution as a fluid. Injection of the vitamin K 10 milligram intramuscularly once a day for 5 days. This vitamin K important because the patient with common bile duct stone, he may have liver impairment, and this liver impairment would cause prolongation of the prothrombin time in PT, and to treat and because the patient have no bile in the duodenum and the intestine, there will be no absorption of the vitamin K because the vitamin K is fat soluble vitamin, methyl vitamin A and vitamin D, and for that point, the patient with biliary obstruction may have deficiency of the vitamin K, and this deficiency lead to formation of prolongation of the prothrombin time and lead to bleeding tendency because the prothrombin time is prolonged because the vitamin K is factor 7 in the gasgate of the coagulation pathway in the liver. That's why we need to give to the patient vitamin K intramuscularly for 5 days preoperatively. Antibiotic, correction of dehydration مثل ما قلنا ونعطيهم mannitol is polysaccharide or starch of high molecular weight, important for the patient with obstructive jaundice preoperatively and intraoperatively and sometimes postoperatively. The importance of the mannitol, which is a polysaccharide of high molecular weight, which is used as osmotic diuresis. Important here, the importance of the mannitol is to prevent what's called the hepatorenal shutdown. Due to jaundice, if the jaundice is very high and deep jaundice, the bilirubin will be deposited in the basement membrane of the glomeruli, causing immune complex reaction and lead to liver failure. So patient with jaundice may end with renal failure. This is called the hepatorenal shutdown due to immune complex reaction by the presence of the bilirubin in the basement membrane of the glomeruli. So to prevent the hepatorenal shutdown, we give mannitol 200 cc 12 hourly to prevent the hepatorenal syndrome. Step during choledochotomy. After choledochotomy, stone and so either laparotomy or by laparoscope, we open the common bile duct. We remove stone by using this Jordan choledochal the choledochotomy forceps. This Jordan choledochotomy forceps. Special forceps يعني مثل خاشوقة صغيرة نفوتها داخل الاوبننج within the common bile duct ونطلع الستونات واحدة واحدة من الcommon bile duct. This is a choledochotomy forceps. Choledochotomy forceps. This Jordan forceps. Or we can use the Beck's dilator to dilate lower end of the common bile duct after remove extraction of the stones. This is called the Beck's dilator. And we put a T-tube. T-tube من اسمه معناه مثل حرف التي. Rubber tube أو يسموه كهر tube. This tube placed within the common bile duct after we open the common bile duct by vertical incision for 14 days. After 14 days post-operatively we do cholangiography to visualize the common bile duct and biliary tree to identify if there are any missed stone within the common bile duct. يعني بعد ما شلنا الحصوات من القناة الصفراء خلينا تي تيوب باليوم الخامس أو السادس نسوي injection of the contrast media, water soluble contrast media, and we visualize the lower end of the common bile duct and the biliary itself. راح نشوف إذا أكو أي حصوة باقية داخل الcommon bile duct إحنا مشاهدها. By this way, also support for the suturing of the common bile duct. من نفتح الكومن bile duct إذا ما خلينا على تي تيوب ممكن أنت biliary fistula. But now the literature talk about the primary closure of the common bile duct without T tube. يعني حاليا خاصة بالتروما if you have a trauma to the common bile duct ممكن نخيط الكومن bile duct بدون ما نخلي تي تيوب. مثل ما تلاحظون هنا هاي الحمراء هاي الحمراء عبارة عن درين مخليه بس هيباتيك باوش. وهاي الثانية هو تي تيوب هاي الرصاصية. هاي تي تيوب مخليه بعد ما فتحنا الكمل بعدك هنا مخليين تي تيوب. هو عبارة أيضا درين بس درين of the biliary tree. الحمراء عبارة عن درين of the parietes of the peritoneal cavity وهذا درين of the biliary tree هو تي تيوب. إذا تي تيوب هو درين of the biliary tree مثل ما تلاحظون. شكرا جزيلا.